Today, Dr. Johnson, we're going to talk about kids. We've all been there, right? We've all been kids. I told you off the air, I've worn glasses since I was in fourth grade. Of course, the glasses that I got had they were big, gigantic black frames, right? And they had the metal bar across the top because my mother was right. If that metal bar wouldn't have been there, I would have wrapped them around a tree as soon as I possibly could, broken them right away, you know? Things have certainly changed when it comes to eyewear, but also I think things have changed for awareness of the importance of eye care. True?
Well, yeah, we've discovered that there's a simple need out there for more kids to have eye evaluations done on a regular basis. We actually recommend that kids, even before they, as part of their patient care of pediatrics, we actually try and have we have a program called the Infancy Program where we actually will see kids at 6 to 12 months, and that's where you're going to see some of the more grotesque things that are marked out there, like crossed eyes or certainly potentially tumors or things like that. Mm-hmm. And also if you have uncorrected astigmatism that if uncorrected throughout life is going to lead to a amblyopic or what we call a lazy eye as we get older.
Dr. Johnson, tell me this. How do you, because this is amazing to me, you have this little child, and one of the problems that these little kids have always had is they can't tell us what's wrong with them, right? Until they learn, of course, how to talk. How do you test an infant's eyes? What do you do?
Well, it's a little different than the which is better 1 or 2 version that we know as adults. What I actually do is we use acuity palettes called grading plates, and that can be used to direct the infant's attention to either a higher contrast or a lower contrast plate. And actually, I've got it down now to the point where we can actually hold that plate up, and it'll actually tell whether or not the child has the equivalent of our 20/20, 20/30 vision.
Really?
And it's not, quite as an exact a science as if you can ask somebody, like I said, which is better 1 or 2.
Yeah, but again, as you just said, it is so important to get to these issues. The earlier in a person's life, the better.
Right. And we also, another technique we use is what's called a Hirschberg photography unit. And what it does is just by taking a picture, you might have actually seen it on Facebook recently. There was a kid, I think we put it on our Facebook page. There was a child that was diagnosed from a friend of his mom's, noticed that on the daughter that there was some kind of a funny look of the eye in the picture. And so she told the mom about it, and the mom went and looked at it, and unfortunately the child had a retinoblastoma, I believe is what it is. And so we use that same photograph to tell if there's any gross abnormalities in the back of the eye, but also the way that light reflects back from that image, you can actually tell whether or not the child might have a crossed eye or not.
Unbelievable. AM 1450, FM 1033, KNSI. Dr. Tom Johnson from Infinite Eye Care is our guest in the studio today. And we are focusing, no pun intended, yes, there is. We are focusing on children in particular today. Okay, Dr. Johnson, why is it so important? And we kind of sort of covered this, that we test kids' vision a little bit more in depth. And, when I think about a child getting their eyes checked, it's always for a preschool kind of thing,
Well, and a lot of people we actually work with a local area professionals to doing what's called a vision screening team. And vision screenings at schools, a lot of parents might think that if they don't get a note from the school, they indicate that their kids are doing just fine. And what's funny about that, even when the doctors of the area participate in the vision screening, so it's going to be about the best potential it can be, even then there's certain things that might not be able to be seen during the course of just a off-site location, especially when it comes to retinal health. But I know a lot of the local nurses that I've spoken to about when they do vision screenings, and I do gather the fact that they're not really that terribly excited about doing them either. Yeah. But when they do them, a lot of times all they do is they just check their visual acuity and say, can you see the 20/40 vision line or not? And if they see it, they give them the pass, and it's okay. Well, unfortunately, seeing 20/40 vision in one or both eyes isn't really a good eye make.
Yeah, exactly right. There's a lot more to look for, isn't there?
Oh, yeah, for sure, especially when it comes to the persons that have a slight amount of uncorrected astigmatism. And the kids that have one corrected eye that's good and one uncorrected eye that's not as clear may go through that vision screening all through elementary school and not understand that there's a problem. But having unequal balance between the right and left eye can lead to vision difficulties that can affect the rest of their lives.
You know, Doc, you are totally piquing my curiosity here about things that we should be looking for. And again, my children are much beyond the infant stage. They've been blessing me with grandchildren now. But what are some of the things that moms and dads, especially if they're first-time parents, right? Because first-time parents freak out about everything. There's no doubt. What are some of the things that parents really should look for that may indicate it's time to give Dr. Tom Johnson a call?
Well, some of the more obvious things are, when the child squints, or if they like to hold their print really close, like when they're coloring or when they're trying to attempt to read when they're children, and they hold print really close or far away from them. Anytime that there's those gross, obvious things, and that's an indicator. And maybe one other one would be, oftentimes a child will try to cover one eye, because when they cover one eye to read, then it prevents them from seeing double vision, which we call diplopia.
What about younger children? I don't want to necessarily go back to the infant thing, because I got to leave that to the experts like you. But what about maybe 2, 3, 4 years old?
I think that the same thing applies to that case. If you have a child that when you look at them, it looks as if one eye might be turning in or turning out. And quite honestly, the most obvious things that brings kid to our office all the time is either a vision screening done at a preschool or preliminary evaluation. But oftentimes it's when the child looks out at the television and they want to sit really close to the TV. I mean, that's a kind of a no-brainer there.
Yeah.
And of course, there's that common sense philosophy parent thing that, I've got children too, mine are growing up as well. But there's that common sense one that says, what kid doesn't want to sit close to the TV, I guess.
Right.
But that can be an indicator that the child might be nearsighted or have a slight uncorrection of astigmatism that might affect their distance vision perception.
AM 1450, FM 103.3 KNSI, Your Health on the radio. Special guest, Dr. Tom Johnson. Would I be right if I said optometrist, ophthalmologist?
Optometrist from the Pacific University College of Optometry.
That's kind of like the Ohio State University there. Said with an awful lot of pride. I will go to the University of North Dakota. There we go. AM 1450, FM 103.3 KNSI. Again, Dr. Tom Johnson is our special guest. Folks, we're going to talk about some of the most common vision issues that he sees at Infinite Eye Care. Maybe some the reasons why we see so many more children wearing glasses. That's got to be a good thing. Catching an awful lot of problems, I would think. We have to find out about the Reading Bug program and the Affordable Care Act and its impact on the eyesight of our children. Dr. Tom Johnson, our special guest this morning, AM 1450, FM 103.3, KNSI.